Hello everyone, today we are going to focus on Unit 15. This Unit 15 is going to cover the detection of mental illnesses in the community. So the objective of today's session is we are going to have a brief introduction on what mental illness is and the prevalence of mental illness, the keys, signs and symptoms of different mental health conditions, the various methods of detection, barriers to detection, community intervention and the importance of early detection. We are concluding the session with few questions in our session. So starting with mental health is an integral component of overall health. According to World Health Organization, health is defined as a state of complete physical, mental and social well-being and not merely the absence of disease or infirmity. This definition underscores the importance of mental health as being equally significant as physical health. Now, when we talk about mental health, there are certain things we need to address. So basically, mental health is something which is in real, something which anyone can have, and it's probably linked with the physical health condition. On the other hand, it's not that shameful to have mental health issues. It's all in our mind. No, it is an issue in our mind. And with that, we are going to look into what exactly mental health is. Mental health encompasses a person's emotional, psychological and social being. So it involves how individuals think, feel and act or behave in a certain condition. It helps us to determine how we handle stress, relate to others and make healthy choices. Just like our physical health, it is important to all people at any age group. Good mental health is not just the absence of mental illness, but it is about thriving and experiencing a sense of fulfillment in life. So, mental health is influenced by various factors including genetics, environment, upbringing and life experiences. Mental health is essential for coping with life's challenges, forming meaningful relationships and achieving one's full potential. It is a dynamic state that fluctuates over time and requires attention, care and support to maintain and enhance. Mental health refers to the overall well-being of how you think and regulate your feelings, which may also affect how we behave in certain ways. Mental stability refers to good mental health, the ability to control and regulate our thoughts, feelings and behaviors according to medical standards, societal expectations and cultural norms. According to WHO, around the world, 1 in 8 people suffer from some sort of mental disorders. Being mentally unstable can affect our ability to function properly in different aspects and settings, including lower performance at school or at work, difficulty in maintaining personal or social relationships, having decreased cognitive skills, but there are no uniform standard for stable mental health, especially considering the societal expectations and cultural norms. Regardless, seeking mental health support is advisable if individuals are feeling mentally unstable and wondering how to feel normal again. So, the mental health is the building blocks of our health condition. So, there are signs of mental health issues like we feel sad, we feel anxious, we feel hopeless, we overthink, there are certain situations where we see that we are not eating properly, we have sleeping problems, we have mood swings, and at times we lost interest for what we were interested in the previous situation. So often people interchange mental health and mental illness, but the two concepts are actually quite different. Mental health refers to our emotional, social and psychological well-being. For example, do I have a job that I enjoy, or do we have a close-knit group of friends whom we can count on? If so, it's likely that our mental health is thriving. Individuals who are stressed about unemployment or in an unhappy marital situation, or who are going through emotions associated with the illness of a family member, are in a different situation. So these people are probably struggling with their mental health and could also resonate their feelings of depression or anxiety. Now the question may arise, is mental illness the same as mental health? As we discussed, while mental health and mental illness sound like two opposing ideas, there is a lot more underneath the surface than we think. So if someone is lacking in good mental health, that does not automatically mean that they are mentally ill. For many, our diagnosis of mental illness is simply an aspect of their life to keep in mind and may not indicate a permanent lack of mental health. So what exactly is mental illness if it is not the other side of mental health coin? So we were going to discuss it now. Mental illness refers to a brain-based condition that alters the way a person thinks. There are over 200 classified forms of mental illness, ranging from anxiety that pops up from time to time to schizophrenia or bipolar disorder that significantly affects how a person goes through their day-to-day life. Mental illness can be triggered by one's environment, although for many people it is related to a genetic factor or a chemical imbalance in the brain. A mental health diagnosis can encompass a wide range of symptoms and conditions. Mental health conditions are disturbances in a person's thinking, feeling or behavior, or a combination of any of these two that reflect a problem in mental functioning. If we have mental health diagnosis, it can cause distress or disability in social, work or family activities. Just as the phrase physical illness is used to describe a range of physical health problems, the term mental illness encompasses a variety of mental health conditions. So to summarize, or in a nutshell, it is important to note that mental health and mental illness are different. Mental health refers to our ability to function effectively in our daily lives, including having healthy relationships, engaging in daily activities, and coping effectively with the problems we face. In contrast, mental illness refers to a diagnosable mental health condition that creates significant changes in how we think, feel, or behave. These changes make it difficult to function and create significant distress. So, mental illness, when we talk about mental illness, the American Psychiatric Association (APA) defines mental illness as a health condition that involves change in emotion, thinking or behavior, or a combination of these. Poor mental health and mental illness are not the same thing, and a person can experience poor mental health and not be diagnosed with a mental illness. Likewise, a person diagnosed with a mental illness can experience periods of good physical, mental and social well-being. People experience different types of mental health issues and they can occur at the same time. Mental illnesses can occur in any short bursts or extended episodes, then subside. Mental illness can also be ongoing chronic conditions. There are more than 200 types of mental illnesses. There is another term that is associated with mental illness, that is serious mental illness, SMI. So this term is used by the health professionals to describe the most severe mental health conditions. These illnesses significantly interfere with or limit one or more major life activities. Two of the most common SNIs are bipolar disorder and schizophrenia. Now we will move on to the next new topic, that is mental disorder. So is mental illness and mental disorder the same? Mental illness and mental disorder are often used interchangeably, but they can have slightly different connotations. Mental illness is the term that is commonly used to describe a wide range of mental health conditions that affect a person's mood, thinking and behavior. Examples include depression, anxiety disorders, schizophrenia, bipolar disorder, etc. Now, when we are talking about mental disorder, is the term which is more clinical and is used to refer to diagnosable conditions that are characterized by significant disturbances in thoughts, feelings and behavior. So, it is often used in medical and psychological contexts. Therefore, mental disorder, also known as psychiatric disorder, is a condition that affects a person's thinking, feeling, behavior or mood. It often leads to a significant distress or impairment in functioning in daily lives. Mental disorder is influenced by a complex interplay of biological, psychological, social and environmental factors. The few key characteristics of mental disorders may be the psychological disturbances like abnormal pattern of thoughts, emotions or behavior, impairment in functioning, that is difficulty in managing relationships, work, school or personal care, and distress, that is significant emotional pain or discomfort caused by various symptoms. Coming down to the signs and symptoms of mental disorder, everyone experiences peaks and valleys in their mental health. A stressful experience such as the loss of loved ones might temporarily diminish our psychological well-being. But in general, in order to meet the criteria of a mental health diagnosis, our symptoms must cause significant distress or interfere with our social, occupational or educational functioning and last for a defined period of time. Now, what is the prevalence of mental disorder? Worldwide, mental disorders are significant public health concern. So, according to WHO, approximately 1 in every 8 people or about 970 million individuals are living with mental disorder according to the 2019 data of WHO. The COVID-19 pandemic has further accelerated the prevalence of these conditions with a significant increase in anxiety and major depressive disorders according to the 2020 data of WHO. Now, mental health needs are high, but responses are often insufficient and inadequate. So, despite the availability of effective prevention and treatment options, many people with mental disorders do not have access to adequate care. So, there is the relevance of understanding mental health. So, understanding mental health is crucial for different reasons. Maybe health is, as we consider health as an integral part of our overall well-being, it affects how we think, feel and act, influencing our ability to handle stress, relate to others and make decisions. Mental health and physical health are closely connected. Poor mental health can lead to physical health problems such as heart disease and chronic illnesses. Now, good mental health enhances the productivity and performance in work and daily activities. It allows individuals to function effectively and contribute meaningfully to their communities. Understanding and addressing mental health issues can significantly improve the quality of life. It helps individuals lead fulfilling lives and achieve the potentiality in our life. Awareness and understanding of mental health can reduce the stigma associated with mental health condition, encouraging more people to seek help and support. Recognizing the signs of mental health issues can help us in early intervention and treatment and preventing more severe problems and promoting recovery. By prioritizing mental health, we can create healthier, more supportive communities and improve the overall well-being of the individuals. So, why mental health is essential for understanding the health condition? So, firstly, from the perspective of the impact in our daily functioning and from the perspective of the prevention of disorder and the role in chronic disease management. So, when we talk about the perspective of the impact on daily functioning, good mental health enables individuals to manage daily stresses, maintain relationships and achieve personal goals. Poor mental health, on the other hand, can disrupt the productivity, education and social interactions. From the perspective of the prevention of disorders, promoting mental health can reduce the risk of developing mental illnesses like anxiety, depression or substance use disorders. Role in chronic disease management. Mental health is critical in managing the conditions like diabetes, obesity and cardiovascular diseases. Now we are going to discuss about the common mental health conditions. There are hundreds of mental illnesses listed in the 5th edition of the Diagnostic and Statistical Manual of Mental Disorders, that is DSM-5, the American Psychiatric Association's Diagnostic Manual. The DSM-5 puts illnesses into categories based on their diagnostic criteria. The most recent version of the manual, the DSM-5-TR text revision, features some significant changes including the addition of prolonged grief disorder, updated language regarding sex and gender, and changes in the diagnostic criteria for more than 75 conditions. So, we are going to have a snapshot of few of the mental disorders within a very limited time. So, first we are going to discuss about the anxiety disorder. Now, anxiety disorder is the most common mental illness and it takes a lot of different forms. Experiencing some level of anxiety is a normal part of the human being, but for people who have an anxiety disorder, the worry or fear do not go away but worsen over time. Some people experience generalized anxiety where the negative thoughts and feelings are present in a variety of circumstances, while others experience social anxiety, anxiety in crowd, and sexual anxiety, just to name a few. Anxiety can cause intense and prolonged feelings of fear and distress that occur out of proportion to the threat or danger at hand. Thankfully, we know that anxiety is treatable. So, anxiety disorder is characterized by significant feelings of anxiety or fear accompanied by physical symptoms such as shortness of breath, rapid heartbeat and dizziness. People with anxiety disorders respond to certain objects or situations with fear, dread or terror. Sensory stimulus such as smell or sound can trigger these negative responses as well. Anxiety disorders include generalized anxiety disorder, social anxiety, panic disorders and phobias. We'll move on to the mood disorders such as depression and bipolar disorders. Mood disorders is an umbrella term that covers a range of mental health conditions. While bad moods are common and usually pass in a short period, people suffering from mood disorders live with more constant and severe symptoms. Their mood impacts both mental and psychological well-being nearly every day. 1 in 10 adults suffer from some type of mood disorder, with the most common condition being depression and bipolar disorder. If left untreated, this illness can affect the role of functioning, quality of life, and many long-lasting physical health problems such as diabetes and heart diseases. Bipolar and related disorders, formerly known as the manic depression, bipolar disorders are characterized by altering episodes of mania, hypomania, and major depression. There are three broad types of bipolar disorder: bipolar 1, bipolar 2, and cyclothymia. Bipolar disorder causes unusual changes in the mood and behavior. While everyone has natural highs and lows, with bipolar disorder, the highs and lows are extreme, impacting the individual's ability to function in their day-to-day life. Intense shifts in mood, energy level, sleeping and eating, and the extreme highs in addition to depression are key components of being diagnosed with the disorder between episodes. People with bipolar disorder can be completely symptom-free. Like all mental illnesses, bipolar disorder shows up differently and depressive state almost all the time, whereas for others it could be years between episodes. Bipolar disorder is treatable. Now, depressive disorders, depression causes severe negative changes in the way we think and feel, make it difficult to manage our day-to-day tasks and activities such as working, sleeping, or eating. Many people with depression feel numb, sad, lonely, and like life has no meaning to them. But for many people, depression recurs and episodes can last up to several years if untreated. So, episodes of depression may occur with or following stressful events, physical illnesses, trauma, loss, major transitions, and financial stresses. They can also happen for no prominent reason. Here, depression is also treatable. The common feature of all depressive disorder is the presence of sad, empty, or irritable mood accompanied by physical symptoms and cognitive changes that sufficiently affect a person's capacity to function. Examples include the major depressive disorder. Very closely related to the mental health disorders, we have the term suicide. Now, this suicidality can be experienced by anyone, especially who has been suffering from major depressive disorder. Approximately 90% of the individuals who die by suicide experience some sort of illness. There are infinite reasons why someone might feel like killing themselves is the only option. Factors that influence this type of decisions may be substance abuse, chronic medical illness, oppression due to an identity, history of trauma, isolation, sleep deprivation, age. Now, age below 25 and over 65 is at the higher risk. We'll move on to the next one, that is disruptive impulsive control and conduct disorder, a group of psychiatric conditions that involve problems with the self-control of emotions and behaviors. This disorder in this group include intermittent explosive disorder, kleptomania, opposition defiant disorder, pyromania. Dissociative disorder. This group of psychiatric syndromes is characterized by an involuntary connection between consciousness, memories, emotions, perceptions, and behaviors, even one's own identity or sense of self. We have the eating disorders, which are a group of conditions that cause serious emotional and physical problems involving extreme food and weight loss. There are many types of eating disorders. For example, it varies greatly in what they look like. They all point to an unhealthy and sometimes dangerous relationship to food. Eating disorders are also treatable, and eating disturbances are characterized by a persistent disturbance of eating patterns that leads to poor physical and psychological health. The three major eating disorders are anorexia nervosa, binge eating disorder, and bulimia nervosa. Next, we have the elimination disorder. Now, children with elimination disorders mostly prevalent among the children. In this disorder, repeatedly these children void urine or feces at inappropriate times and in inappropriate places, whether the action is involuntary or not. So, according to APA, there are two types of elimination disorders, namely the enuresis, that's urinary inconsistence, and the encopresis, that is the fecal inconsistence. Next, we will move on to the gender dysphoria. This was formerly known as gender identity disorder. Gender dysphoria occurs when a person feels extremely discomfort or distressed because their gender identity is at odds with the gender they are assigned by birth. We have the neurocognitive disorders. Now, these disorders are characterized by a decrease in the person's previous level of cognitive function. So, in addition to Alzheimer's disease, other conditions in this category include Huntington disease, neurocognitive issues due to HIV infection, traumatic brain injury, etc. We have neurodevelopmental disorders. So, according to WHO, neurodevelopmental disorder starts manifesting during the developmental period of life and cause complications in how we grow and learn. This negative effect on mental development could mean that an individual has a harder time developing intellectually or socially. So, they may also struggle with motor functions or acquiring languages. These disorders typically manifest early in the developmental stage, often before a child enters to the grade school. They are characterized by impairments of personal, social, academic or occupational functioning. Examples of neurodevelopmental disorders include attention deficit hyperactivity disorder, autism, learning and intellectual disabilities, etc. So, when we talk about ADHD, it begins in the childhood. People who live with ADHD can have trouble in paying attention, might not be able to determine the appropriate amount of physical activity for a given situation and act before thinking and find themselves daydreaming. They also find it hard to focus, organize and complete or accomplish a task. ADHD is again treatable and it is one of the most common childhood mental disorder. It can continue through adolescence and adulthood. People diagnosed with ADHD may have trouble paying attention, controlling impulsive behaviors and overactively point to self-detriment. Autism spectrum disorder is a developmental condition that affects how people communicate, learn, behave and interact with others. So, the symptoms of ASD may include difficulty with social interaction and communication and may have atypical behaviors and activities. So, they may also have a strong focus on details and may have unusual reactions to certain situations. We have the learning and the intellectual disabilities. There may be misunderstanding when it comes to disorders that affect our ability to learn and function. For example, some people may think that intellectual disabilities and learning disabilities are the same, but actually they are not. Intellectual disabilities are lifelong conditions that affect someone's ability to develop, learn, function at expected levels. Children with intellectual disabilities may develop more slowly than other children and they may score low in numbers of different intelligence tests. Examples of intellectual disabilities include Down syndrome and fetal alcohol syndrome. On the other hand, when we talk about learning disabilities, it affects a child's ability to learn specific skills like reading, writing, or concentrating. While learning disabilities can affect many areas of child's life, these children typically develop normally and have average or above average intelligence. Examples of learning disabilities include dyslexia, dysgraphia, etc. The next disorder we are going to discuss is about the obsessive compulsive disorder. Now, this is a specific form of anxiety characterized by repetitive, unwanted, intrusive thoughts, that's obsession, and irrational excessive urges to do certain actions, that's the compulsion. For some people, the compulsive behavior comes from trying to reduce anxiety or obsessions. Genetic tend to play an important role in developing OCD. So OCD can look different for different people. For some, it involves cleaning self and spaces compulsively. For others, the OCD might present in the form of counting, tapping, or something numeric, or myriad of other forms. So examples of OCD and related disorders include body dysmorphic disorder, hoarding disorders, etc. The next we are going to discuss about the paraphilic disorder. Now, this paraphilic disorder describes the intense or persistent sexual interest that cause distress or impairment. These may involve recurrent fantasies, urges, or behaviors involving atypical sexual interest. We have the disruptive behavior disorder. Behavioral disorders involve a pattern of disruptive behaviors in children that last for at least 6 months and cause problems in school, at home, and in social situations. So, behavioral symptoms can also continue into adulthood with the disruptive behaviors becoming impulsive to the point of serious self-detriment. We have the personality disorder. People with personality disorders have extreme and inflexible personality traits that cause problems in work, school, or social relationships. Sharp and sudden personality changes can also be present. Personality disorders include antisocial personality disorder and borderline personality disorder. Thus, these disorders are characterized by an enduring inflexible pattern of experience and behavior that causes distress or impairment. There are currently about 10 recognized personality disorders. Antisocial personality disorder is basically a mental condition, is characterized by disregard for the rights of others, frequent violation of societal norms, and lack of empathy or remorse for harmful actions. Borderline personality disorder causes dramatic changes in someone's mood, behavior, and relationships. Often people with BPD have a strong desire to be close with someone but also have an inability to trust that person. So, their relationship can be constant push and pull of phase where we say, please stay here with me. So, this is a phrase we can, apply for them, and get away from me. So, because people with BPD have a hard time regulating their emotions, they can take impulsive actions driven by extreme shifts in the mood. Anger morphs into depression, which evolves into elation within just a few hours. So, borderline personality is again treatable. We have the schizophrenia, spectrum, and other psychotic disorders. People with psychotic disorder hear, see, and believe things that are not real or true. They may also show signs of disorganized thinking, confused speech and abnormal motor behavior. These disorders are defined by abnormalities in one or more of the area like delusions, disorganized thinking, disorganized or abnormal motor activities or behavior, hallucinations and negative symptoms. Negative symptoms include a decrease in emotional expression, reduced ability to experience pleasure, lack of motivation, social withdrawal and difficulty in speaking in the public forum. We have the next one, that's the sexual dysfunctions. This heterogeneous group of disorders is characterized by a person's inability to fully engage in or experience sexual pleasure. Some of the most common sexual dysfunctions include delayed ejaculation, erectile disorder, female orgasmic disorder, female sexual interest or arousal disorder. Sleep-wake disorder, there are several different types of sleep-wake disorders and all involve problems in falling asleep or staying awake at desired or socially appropriate times. These disorders are characterized by misalignment of circadian rhythms with the surroundings of environment or abnormalities of the circadian system itself. Common sleep-wake disorder include insomnia or narcolepsy. We have the somatic symptom and related disorders. People with these disorders feel extreme, exaggerated anxiety about physical symptoms such as pain, weakness, shortness of breath. This preoccupation is so intense that it disrupts the personal life of the individual. We have the substance related and addictive disorder. Substance use disorders occur when frequent or repeated use of alcohol or drugs cause significant detriment such as health problems, disability and failure to meet major responsibilities. Substance use problems can be fatal to the user and put others at risk. Examples include drinking and driving or overdosing. Mental illness and substance use disorders are often go hand by hand. That means it can occur at the same time. And the combination of the two can worsen the situation at the same time. So, all substance related disorders are characterized by a cluster of behavioral and physical symptoms which can include withdrawal, tolerance and craving. Substance related disorders can result from the use of 10 separate classes of drugs. We have the trauma and stresses related disorders. This group includes disorders that are related to the exposure to a traumatic or stressful life event. The most common is the post-traumatic stress disorder, that is the PTSD. So, PTSD is a response to a traumatic event or a series of events. Sometimes that is traumatic for a person, might not be traumatic for others, but what matters is how they experience the traumatic situation. It includes flashbacks, anxiety, uncontrollable movements and thoughts, hypervigilance, physical and emotional triggers are few of them. So, we see them having frequent panic attacks, irritability, etc. So, what are the causes of mental illnesses? We have a range of causes that have been identified. The biological cause, where we say the brain chemistry plays an important role in mental illnesses. We have the environmental exposure, where we say that certain substances when a child is in the uterus or a person is in the environment are exposed to leads to certain situation which can lead to mental illnesses. There are genetic factors which are, for example, in schizophrenia, we consider it as that genetic factor is important in this type of disorders. Life experiences, stressful life events, what we are experiencing may contribute to the development of mental illnesses. Getting a mental health diagnosis. So when we are getting a mental health diagnosis, it is a multi-step process that include more than one healthcare providers. So how we start with is the primary physician. So we may go to a medical professional for a problem what we are facing, and then the doctor use the DSM or the ICD to diagnose a disorder. So both the guidelines explains the signs and symptoms of all the mental disorders. Mental health disorders diagnosed may be based on some other factors like collecting the data on biopsychosocial aspect covering many aspects. We have maybe the individual's history, medical history, the individual's family's history, any major incident in the past or at present, physical health issues, alcohol and other drugs issues, etc. So after checking all these issues, after covering or collecting information from all these issues, they try to assess individuals' mental health concerns and the reasons for seeking help. So reviewing any past or current thoughts about committing harm is also included in that part. So when are we supposed to seek help? We need to pay attention in the following symptoms. For example, apathy and prolonged sadness, if we feel anxious and we have a lot of phobias, irritability, extreme mood swings, tendency to be isolated, suicidal thoughts, and after all, substance abuse. So what are the methods to detect the mental health conditions? At the community level detection, we can have different types of awareness camps. Also, observing the behaviors of the individuals at school, at workplace or social gatherings. So we can have different mental health professionals in the different settings. So mental health problems are detected through a combination of methods including the medical history, the physical exam, the lab test, psychological evaluation, the DSM, the Diagnostic and Statistical Manual of Mental Disorders, and then the doctor will consider our situation. So accordingly, the doctor may refer us to a specialized doctor, that is a psychiatrist or a psychologist based on our need. We have the role of the non-medical personnel like the teachers, the community worker, the family members in early identification. So the teachers can observe the children in the school and share it with their supervisor. Family members can also be involved in early identification process by sharing information about the child at home, such as their favorite toys, communication skills, and response to routines. Community workers can help to identify the children with disabilities by conducting disability survey and medical camps. They can also help individuals with disabilities who enter mainstream schools and make them aware of their strengths and abilities. We can at the same time have partnership with all these stakeholders to strengthen the early identification or detection process. We have the barriers like the social stigma, that is the fear of judgment or discrimination. We have barriers as the lack of awareness. There are various myths and misconceptions about mental illness, and assess issues like there are limited resources or professionals in different areas, specifically in rural area where we cannot help the person in need at that moment. So mental illness is a widespread and required attention to improve detection and management. So recognizing the symptoms using effective detection methods and addressing barriers like stigma and lack of awareness are very important. Community interventions such as awareness programs, integrated care play a vital role in overcoming these challenges. Early detection is also important for better outcome, reduce societal burden, and fostering mental well-being in our communities. Raising awareness through public education campaign, community programs, school curriculum and accessible resources can help to reduce the mental health issues. Encouraging open discussions and reducing stigma will empower individuals to seek help and improve early detection. So with this, we are going to complete this particular unit. Now we can ask ourselves a few questions. The important concepts that we have covered here is what mental health is, what mental illnesses are, and how does it differ from mental disorders. There are certain disorders which we see very common among individuals, and these disorders become a problem later on if they are untreated. So, keeping this in mind, we need to understand what are the signs and symptoms of different disorders and how we can treat them. What is the important role of early detection? Why is it important to why is it important for all the stakeholders in terms of mental health to help the individuals in need of mental health crisis? So with this, we are concluding this chapter, keeping in mind the few questions that we have talked about. Thank you.